Welcome to the United States of America, where it is said that health is a right for everyone. And in reality, fraud is also available to everyone. In a country that loves bureaucracy as much as it loves hamburgers, they invented a system called Medicare and Medicaid and called it the nation's health shield. A system that spends more than $700 billion annually, guarantees treatment for the elderly and those with special needs, and is supposed to protect them like a mother's blanket of affection. If only it weren't perforated on every side. The shocking news? 1 out of every $10 in this system doesn't go to treat anyone. Instead, it's hijacked, stolen, swallowed, and flies off with the first bank transfer to Hong Kong or the Caribbean. The process is so simple. It's so simple, you might think it's a TikTok prank. Fake medical bills, imaginary psychiatric sessions, fake DNA tests, medical devices received in a dream. Then came what the movie was missing, a catchy name. And so, in June 2025, Operation Gold Rush began. No, not to prospect for gold, but to hunt for thieves in white coats, carrying medical degrees, signing fake bills with hands trembling with greed. What did they find? More than 324 people were involved, including 96 healthcare professionals. Yes, the ones who were supposed to write you a prescription for healing, who wrote a prescription to empty the coffers. And so, a system designed to protect the vulnerable has become a fast food thief's kitchen. The meal comes to you ready-made. You don't even need to see the patient. Imagine a medical company with no patients, no doctors, no equipment, no employees even, just an empty office. And yet it issues invoices worth hundreds of millions. How? Very simple. Welcome to the American Fraud Club, where companies are built not to treat people, but to steal from the system, and then run away. Starting in Connecticut, a man from the Czech Republic, Kevin Valdins, entered the medical market through the widest doors, and bought a company called Medical Home Care for just $400,000. In 2 months, his beautiful company submitted $7 million in fake invoices. To whom? To the elderly and disabled whose data he used without their knowledge, as if they were clients on the Victims of the Day list. And the most amazing thing? Not a single medical item was delivered. But the money came in and traveled to Malaysia and Hong Kong, passing through encrypted, shiny accounts that even Google can't hack. The authorities woke up after the man started thinking about opening a branch on Mars. The result? 28 accounts frozen for $17 million, and an open case for fraud and money laundering. Moving on to Kentucky. Bowling Green, a company called Priority One Medical Equipment. Same play, but IMAX-sized, a completely empty office, and yet it issued invoices for $667 million. For what? Urine and glucose devices that no one saw, no one used, and perhaps never existed. The operation was carried out with the help of an international network. Russia, Estonia, Kazakhstan, VPNs, bank transfers, codes, influencers, approximately. Frozen losses, over $5.5 billion. Other companies? Same scenario, same disaster. WellCare Diagnostics, New Jersey. Fake DNA tests, $6 million. BB Medical Equipment Inc., New York, $8.2 million in invoices, and the money went to home improvement. Why not? Cure Healthcare, California, $12 million from selling fake prescriptions. Yes, prescriptions have become a commodity like debit cards. SKF Enterprises and Call MD Plus, Florida. Companies that generate fake signatures from outsourced call centers. Doctors are on the line, but not on the right line. One Medical Services and Liberty Medical, $305 million in invoices, funded directly from taxpayers. All of these companies were money factories, producing nothing but illusions, forged documents, and rigged bank transfers. Then, the doctors entered the scene not as heroes, but as directors, big stars in the American Medical Fraud series. And that's the end of part 1. But the real madness is just getting started. Stay tuned for part 2.